Namaskar. Welcome to my YouTube channel. Today we are going to discuss about Aiims Norcet previously related most important questions. Part 3. Let's start. The first question. The nurse is assigned to a patient who has a bacterial pneumonia and is under droplet precautions. Which personal protective equipment PPE will she wear to deliver the meal tray? Option A. Special filtration mask and gloves. Option B. Only mask is needed. Option C. Gown, mask, gloves, shoe covers. Option D. No PPE required. The correct option is option B. Only mask is needed. Artificially acquired immunity is obtained by option A. Recovering from a disease. Option B. Being breastfed. Option C. Immunization with antibody response. Option D. Exposure to a disease. The correct option is option C. Immunization with antibody response. Gestational diabetes increase risk for the following except option A. Congenital anomalies. Option B. Small for dead fetus. Option C. Macrosomia. Option D. Prematurity and stillbirth. The correct option is option B. Small for dead fetus. Which of the following would not promote trust in the nurse-patient relationship? Option A. Returning at the stated time. Option B. Fulfilling promises. Option C. Maintaining confidentiality. Option D. Examine a wound without providing privacy. The correct option is option D. Examine a wound without providing privacy. Refrigerated breast milk should not be used if it is beyond option A. 1 week. Option B. 48 hours. Option C. 2 months. Option D. 2 weeks. The correct option is option B. 48 hours. The most significant characteristics experienced by a patient with depression is option A. Hypervigilance and nightmares. Option B. Lack of impulse control. Option C. Aggressive, abusive or violent behavior. Option D. Depressed mood and loss of pleasure or interest. The correct option is option D. Depressed mood and loss of pleasure or interest. In the liver, bacteria that found their way into portal circulation is destroyed by option A. Kupffer cells. Option B. Cilia. Option C. Hydrochloric acid. Option D. Leukocytosis. The correct option is option A. Kupffer cell. Medical asepsis differs from surgical asepsis in that it is aimed at option A. Killing all microorganisms. Option B. Sterilizing all equipments. Option C. Preventing entry of microorganisms into the body. Option D. Preventing transmission of microorganism. The correct option is option D. Preventing transmission of microorganisms. Circlage, encircling cervix with sutures, is done for patient with option A. Incomplete abortion. Option B. Complete abortion. Option C. Threatened abortion. Option D. Incompetent cervix. The correct option is option D. Incompetent cervix. The cerebrospinal fluid is secreted by option A. Central sulcus. Option B. Arachnoid villi. Option C. Choroid plexus. Option D. Sponge. The correct option is option C. Choroid plexus. The inflammatory or exudative phase of wound healing will last for option A. 1 year. Option B. 1 to 4 days. Option C. 5 to 20 days. Option D. 21 to 1 month. The correct option is option B. 1 to 4 days. The person who becomes short of breath with little exertion, such as when eating a meal, has what kind of respiratory condition? Option A. Dyspnea. Option B. Hyperventilation. Option C. Stroke respiration. Option D. None. The correct option is option A. Dyspnea. Which of the following is the most abundant type of blood cell? Option A, lymphocyte. Option B, monocyte. Option C, thrombocyte. Option D, erythrocyte. The correct option is option D, erythrocyte. The traditional source-oriented narrative type of charting is characterized by all of the following forms except option A, doctor's progress sheet. Option B, history and physical examination form. Option C, laboratory sheet. Option D, database form. The correct option is option C, laboratory sheet. The main cause of genital warts is option A, human papilloma virus, HPV. Option B, pelvic inflammatory disease. Option C, Neisseria gonorrhea. Option D, herpes simplex virus. The correct option is option A, human papilloma virus, HPV. The normal levels of sodium in plasma is option A, 135 to 143 milli equivalent per liter. Option B, 297 to 106 milli equivalent per liter. Option C, 390 to 196 milligram per 100 ml. Option D, 460 to 100 mg per dl. The correct option is option A, 135 to 143 milli equivalent per liter. Role of community nurse in school health program except option A, to provide immunization to the children. Option B, assist in screening physical, mental and other special examination of children in school. Option C, assist in communicable disease control. Option D, assist in school medical examination and follow-up. The correct option is option A, to provide immunization to the children. Phototherapy is indicated for children with option A, hypoglycemia. Option B, necrotizing enterocolitis. Option C, hemolytic disease. Option D, hyperbilirubinemia. The correct option is option D, hyperbilirubinemia. Para is defined as option A, total number of pregnancies. Option B, number of past pregnancies gone beyond period of viability. Option C, born from beginning of 38 to 42 weeks. Option D, any pregnancy terminates before the period of viability. The correct option is option B, number of past pregnancies gone beyond period of viability. In rheumatoid arthritis, during the acute phase, the values which are significant are option A, LFT elevation liver function test. Option B, ESR and C-reactive protein CRP elevation. Option C, CBC elevation complete blood count. Option D, RFT elevation renal function test. The correct option is option B, ESR and C-reactive protein elevation. Thank you for watching. Please like and subscribe.